Hi guys, I want to teach you about epilepsy. What is actually epilepsy is, what is a pathophysiology behind it, and how we get classified it, and how the patient present with the symptoms. So let's start about it. Okay, so for epilepsy, we should first understand what is seizure, because when you talk about epilepsy are actually the recurrent episodes of seizures. Okay, so first you should know what is seizure is. Seizure is actually the abnormal electrical activity in the brain which manifests in the form of abnormal motor, sensory, or psychomotor experiences. Okay, this is actually the definition of seizure is. Now I want to elaborate it. Actually, we can't just say that seizure is abnormal electrical activity in the brain. It's not a complete definition because many times in our brain, abnormally the neurons fire, but it doesn't manifest in any abnormal fashion, neither in a motor, sensory, or nor in a psychomotor fashion. Okay, so for seizure, a patient should experience the symptoms. Okay, like abnormal electrical activity in the brain, which leads to manifestations of some symptoms, then it will complete the definition of seizure. Okay, I mentioned on the top that every seizure is not an epilepsy. Why I wrote it? It is because that uh, a single seizure episode does not mean epilepsy. It can be from other reasons too. Like, say, for example, hypoglycemia can lead to an episode of a seizure. Overdose of any drug can lead to an episode of a seizure, but it won't be epilepsy. So, what's the difference between seizure and epilepsy? Actually, when seizures recurrently occur due to abnormally electrical neurons, when they fire abnormally in the brain, then we call it epilepsy. Okay, so for epilepsy, as I mentioned on the board, that for epilepsy the seizures should be recurrent. Okay, does it make sense? I hope so. Now next come towards the what the pathophysiology behind it. Actually, in epilepsy or in the seizures, what happen, the neurons fire abnormally, like more than normal. Okay, so what's the reason behind this? Whether the inhibitory pathway like GABA, as I mentioned, decrease, like its firing decrease, or the excitatory pathway excites more. Okay, the reason behind the pathophysiology of the seizures is this. Now, as we know that there are different types of neurotransmitters in our brain, and depending on these neurotransmitters the neurons fire according to that, whether in an excitatory fashion or whether in an inhibitory fashion. Say, for example, the glutamate, the cholinergic, the aspartate. Like, remember in a way that CAG, like CAGE, CAG, remove the E, and the three words left behind are three alphabets: CAG, cholinergic, A for aspartate, and G for glutaminergic. So CAG are actually the excitatory neurotransmitters, while the main inhibitory neurotransmitter is the GABA. So in the seizures, what happened, whether the inhibitory pathway fires less than normal or the excitatory pathway fires more than normal. So that's why the neurons fires abnormally. Okay. So I elaborate the glutaminergic pathway like excitatory and the GABA pathway which is inhibitory. In the glutaminergic pathway, what happens? AC refers to acetylcholine. When acetylcholine move into neuron, it does what? It does cause the release of the entrance of the sodium, like up by opening of the sodium channels gets open and the sodium flows into the neuronal cell. When inside the neuron the sodium flows in, it causes what? It causes the entrance of the calcium. Okay, when calcium comes inside the cell, the green in the green and whether the doors, these are actually the vesicles, and the vesicles having the glutamate. Okay, I didn't mention, but mm, listen to my words. The in circle form, these are the vesicles, and inside it are the glutamate. What happens when the calcium flows in? It leads to the fusion of the vesicles through the cell membrane and the glutamate released from the vesicles, and they act on their respective receptors like AMPA and NMDA receptors and cause to activation of the sodium like cationic channels, sodium calcium, and they enter into the cell like positive, the red, the by red markings which I showed. Positive signs means the cations load into the cell, and it causes the action potential, AP action potential, and that's how the neuron fire. So this is a normal pathophase of the glutaminergic pathway. While the GABA pathway, what happens? You should know what is GABA. GABA, glutamate is actually the precursor of the GABA. So from the glutamate, the GABA forms, and this is a GABAergic neuron, the next one. Okay, what happens when the GABA neuron fires? What happened? The GABA move in the vesicles having a GABA. When GABAergic neuron fires, the GABA vesicles fuse with its cell membrane and the GABA release from the cell, and then it acts on the GABAergic receptors. Actually, I mentioned just their GABA A receptor, but there is also a GABA B receptor too. So what's the difference between it? GABA A receptor actually act in a way that it, when on the GABA A receptor, the GABA binds, it leads to the activation of the chloride channels. So the chloride goes into the cell and leads to the hyperpolarization of the cell because it is a negative charge molecule. Okay, while the GABA B receptor is that when on the GABA B receptor the GABA binds, it causes what? It causes activation of the potassium channels, and the potassium move out of the cell, leads to again hyperpolarization of the cell, and that's how the neuron doesn't fire. Okay, now a trick, a mnemonic to remember this: the GABA A and the chloride, they both are linked. A C, chloride C, as chloride starts from C, and GABA A. So remember in a way that AC, air conditioner. Okay. Now comes to the classification. Now you should remember, keep this in your mind, that in the brain abnormally electrically activity happens. Now which symptoms will present, how the patient will present, whether in the form of motor, sensory, or psychological symptoms, it depends on which area of the brain is firing abnormally. As I mentioned on the side, that if the neurons in the occipital region are firing, marked on the right side, if they are firing abnormally, what will happen? The person will perceive the visual symptoms. Okay, in the sensory, in the last row, visual hallucinations, occipital lobe. If the neurons in the occipital lobe abnormally firing, person will having the visual symptoms or visual hallucinations. Okay, now there are different areas for the motor, sensory. Actually, motor is that area which is a precentral gyrus area, while the postcentral gyrus area is a sensory. Okay, if the abnormal neurons which are firing abnormally, if that neurons are located in the precentral area, the patient will having a motor symptoms. If the neurons are firing in the sensory area, then the patient will present with the sensory symptoms. Okay, now in easy way to remember, pre comes first, pro comes later. Okay, like pre-central gyrus, post-central gyrus, pre and then pro, like first and second. Okay, so ms, if we go in a if we go alphabetically in an order way, the m comes first, the s comes later. So pre comes first and m comes first. So in the pre-central gyrus there is a motor center. In the post-central gyrus, there is sensory symptoms. their sensory center. Does it make sense? I hope so. Okay, next we classify that epilepsy is located to which cerebral hemisphere. Actually, we in our brain there are the two hemispheres. Okay, if the neurons which are abnormally firing are just located to one cerebral hemisphere, then we call it as a partial seizure or partial epilepsy. If neurons which are abnormally firing, if they are firing from both the hemispheres, then we call it as a complex. Okay, so the classification of the seizure or the epilepsy into the partial and complex is on the basis that how many hemispheres, cerebral hemispheres are involved, whether one or two, as I marked in a way that the star in a black. One star in one cerebral hemisphere, the next the two stars means in both cerebral hemispheres, neurons are abnormally firing, like burst, burst. Yeah. So partial is that in which the cerebral one part of the hemisphere is involved in abnormal firing, while in the complex, the both cerebral hemispheres neurons are abnormally firing. Now the partial we divide it into two, simple and complex. Actually, they both are divided only and only for one cause, that whether the patient losing their consciousness or not. LOC, loss of consciousness. In a simple, no consciousness. So cross. In a complex partial, there is loss of consciousness. So take. Okay. While in complex, as both the hemispheres are involved, so there will be definitely there will be the loss of consciousness. So that's why the complex seizure is not further divided. Okay. Come towards, as I mentioned, that they will present they will show their symptoms whether in the form of seizure, motor, sensory, or psychological. Okay, depends on which area of the brain is abnormally fired. So the motor is divided into further tonic, clonic, tonic, clonic, atonic, myoclonic. Okay. In the tonic, what happens? The patient presents in a way that their body gets stiffened, stiffness of the body. While in the clonic, there are jerky movements. In the tonic, clonic, what happens? First, the body gets stiff, then jerky. While in atonic, all body loses tone, like a lump of meat, while in myoclonic there's a one single jerk. So whenever someone asks you that in a clonic and in a myoclonic there are jerky movements, how we will differentiate? The differentiation point is that in the clonic there are jerky movements, continuously jerky movements, while in myoclonic there's a one single jerk. Say for example, a person having a pain and he develops symptoms of myoclonic, what happens? His pain moves far away, a single jerk. Okay, so now I want to tell you a little bit the pathophysiology behind the tonic and clonic. What happens in the tonic? Why there's a stiffness of the body? Actually, what happens? Agonist and antagonist muscles fire simultaneously in the tonic. That's why the body gets stiffened. Why in a clonic? What happens? The agonist and antagonist muscles alternatively fire and very fastly. So that's why they present with a jerky movement. Okay, come towards the sensory. In a sensory, what will happen actually? The sensory area will fire, and sensory area is that the postcentral gyrus. Okay, the parietal lobe. Abnormal sensations can happen. While actually in the temporal lobe, there are also the centers for the